Hey, this class of drugs has been notorious for a long time. We've got really good data on it, really good clinical experience. So we know benzodiazepines, also known as minor tranquilizers, have really short half-lives, which means they have withdrawal effects. And those are excruciating. Not can be, they are excruciating. And so you need to take those as prescribed and work out the timing and the minimal dose with your professional witch doctor. You need to do that so that you can actually benefit from it. Now, I have only seen two clients in practice who actually needed it. I'm not going to go into hows or whys, but there are people who really do need this. Most people don't need it. And the problem is it results in them getting sloppy in managing their own adrenal glands so that they end up with adrenaline leaking out, squirting out, causing anxiety at different hours, different times, and they cause panic attacks. It is horrible. You do not want to stop a benzodiazepine abruptly. Why? Because it can result in withdrawal. Don't call them discontinuation effects. That's a bunch of bullshit jargon so the psychiatrists and big pharma can cover their asses. If you stop taking a benzodiazepine, there's a good chance, well, you're going to be uncomfortable, but you absolutely could go into a damn coma and die. If you're on a benzodiazepine, steady state is the name of the game. If you want to get off of it, it's called long-term taper, baby. And 2 years is what it takes on average. Depends on how long you've been on it. If you've been on it for a couple of years, it'll take you quite a while to get off of it. And if you're older, over the age of 50, it takes twice as long to clear the synapses, so it takes twice as long to clear it and get off of it. And it can be agonizing. It is torture. Yes, it is horrible, horrible treatment. So my recommendation is, I know sometimes they'll substitute one diazepine for another, and sometimes they use diazepines in withdrawal and inpatient treatment for people that are detoxing. They'll give them a week of some minor drug that's just got a little bit of an effect so they aren't totally uncomfortable. If that's the case, do take it. I do appreciate the people in Singapore for their approach. Their approach is they put you in the prison cell and you don't even get anything to sleep on. You got a cement floor. So you will go through your withdrawals as hard as possible. Why? So that you really learn your lesson. They want you suffering in agony. They want you thinking you're about to die. That way you learn your lesson maybe, and you won't do it again. That's a good reality check. And I consider that acceptable. You may think I'm mean, but I think it's acceptable because it really basically saves your life and it cures you of wanting to go back on that shit again. But over here, so you need to taper off slowly. I could go through that. A colleague of mine, a peer, published a book a long time ago called Your Drug Could Be Your Problem. He co-authored that with Peter Bregan, and they go through how to discontinue, so you can get that from the book and working with your practitioner. I suggest you buy the book, you read the book, and then you go to the fellow woman who is prescribing your medications. And if they're not at a high level, then I suggest you go to somebody at a high level. You get better treatment, generally speaking, from somebody at a higher level. You don't want a nurse practitioner writing psych meds for you. You don't even want a general practitioner medical doctor writing psych meds for you because they don't know their ass from a hole in the ground. They all think they're God. They all think they know what's best, and they don't. And they actually don't realize that they're actually causing more damage than good, more harm than good. To give you an example, I think the half-life on Xanax is 30 hours. That's the famous one. Which means that the drug is only half of effective at 30 hours, which means you're going to have panic attacks. Your adrenal glands are going to be leaking adrenaline into your blood into your circulation, and you're going to be anxious. And you may even have whopping big panic attacks. And some people have seizures. Some go into comas, some die. So that's all I got to say about benzodiazepines. I'm not going to tell you how to discontinue them. I'm not going to recommend you discontinue them. I'm going to recommend that you see the person who's prescribing, and if they aren't any good, get somebody who's good. Don't be afraid to change practitioners. Or if the practitioner has got a supervising MD over them, ask to see the supervising MD. You're going to get better treatment because everybody's going to go, oh shit, we're not doing this right. He's asked for the big guns. Ask for the best. Ask for the big guns. Treat yourself better. And if that fellow turns out to be a jackass that doesn't agree with the path you want to take for yourself in your life, then get a second opinion and get a third opinion. And there's all kinds of different types of supports you can put in place before you attempt to discontinue. Now, benzos you can overdose on those son of a bitches, so I think it's a good idea to get rid of them. And they also dull you to the point where you're really not living, not at your full potential. You don't have the full range of your senses for input. And everything else is blunted too. So may Yahweh bless. That's benzos.